Welcome back to Healthline, and I am still Gregory Zarin, joined by my wonderful guest, Dr. Katrina Miller. And before the break, I had to cut Dr. Miller off because we were talking about the digital rectal exam and men of a certain age getting checked for prostate and colon cancer. I'm so sorry for cutting you off.
No worries.
Can you revisit that again?
Okay, so the idea is basically at the age of 50, there's a big turning point where that's the point at which we want to start screening for things like colon cancer and prostate cancer.
So 50 not, I've heard 40, I've heard 45.
50 is generally accepted.
Okay.
Now, unless there are other risk factors that make us want to screen earlier.
Which means
Say
family history?
You had a family history,
Okay.
or for black men with prostate cancer, actually black men have a higher rate of prostate cancer and developing into metastatic cancer and death. So we want to check them earlier. So if you have more risk factors, we might check you earlier, but 50 is kind of the magic age. So people come to my office, men come to my office at the age of 50 and they're just dreading it and they don't want to have to know what they have to do. But like I said, there's choices available. So the idea with, first of all, we're going to do the exam that's right for you. We're not going to force you into an exam that you don't want to do. So first, let's just say that. And second of all, the prostate-specific antigen, the PSA test, is a blood test. So we'll just throw that in with your blood test. And even that doesn't need to be done every year. Generally speaking, studies are showing at this point that we can do that somewhere between 2 and 5 years and actually have a benefit for decreasing death because of prostate cancer. And so we don't need to do it every year, and we really have to be careful with the PSA because it has led to many more men getting prostates removed and prostate biopsies. And so we have to be a little more careful nowadays with what we do with that information. So as the patient, as a man, be educated, look into whether you feel like you really need to be getting that PSA every year or if you want to stretch it out a bit. Then with the colon cancer, everyone thinks about colon cancer, I have to get the colonoscopy. Well, that's not the only way to go. The colonoscopy does have risks. It's a procedure, and so it's something where, we have to be kind of careful with when we do it. We can also do a stool test, which will check for blood in the stool, and we can do that every year and actually get a good reading at this point on the kind of tests we have now as to whether you seem to have any indication of cancer based on that test, and that can lead us to getting something else.
And that's the
like
age 50?
Starting at age 50, right. And that would lead us to whether we would need a colonoscopy or a flexible sigmoidoscopy, which does a little less of the colon, or even something like a barium enema, which is an imaging study that we can do. But if you have a family history of risk, or if you have genetic risk because of someone in the family with colon cancer, then we really do want to go to something like a colonoscopy, because that's going to give us not only the best view and the best information of what's going on with the entire colon, but we also have the opportunity to get a piece of the tissue, a biopsy, to be able to send to pathology and see if it looks like something concerning or not right there at that time. And then once you've had a colonoscopy done as a screening test and there are no problems, you don't have to have anything done for 10 years. Fantastic. So that really sets you up.
Now, one thing that we haven't addressed much is heart disease. And men, how do men get tested for heart disease?
Well, we were talking about that a little earlier, and that's in the sense of screening them for things like high cholesterol, screening their blood pressure, making sure they eat healthily, making sure they're getting a lot of exercise. No smoking. Get off the smoking as fast as you can, because that is danger for heart disease.
How fast does your body repair itself?
It depends on how long you've been smoking, if you're talking about smoking.
Yeah, I smoked for 20 years. I haven't smoked for 5. Am I pretty much back in the game?
Well, I would like to, basically 5 years is where we really start seeing the major improvements. So yes, but it really depends on how your body reacted to that 20 years of smoking.
Because immediately, though, the cilia in your lungs start coming back. You start breathing slowly and gradually better.
Right. So definite improvements no matter when you can quit, at least for the most part, unless you've already developed lung cancer. But definite benefits. Go ahead and stop no matter how long you've been smoking. It's still a good idea.
Because when you smoke, they say you lose time. When you quit smoking, do you get time back?
In terms of your lifespan?
Sure.
I'd like to say yes, but I can't say statistically, certainly.
Well, then I'm going to hope for yes. Here we are with an elderly gentleman. Billy is now 75, 80.
Yeah.
What does he need to know about his health?
Right, and really the same things. You still want to be as active as possible. You still want to be thinking and reading and trying to use your brain as much as possible because, of course, at this age, it's not just about the physical aspects that start declining, but also mental functioning starts declining. And so you really want to, it's almost like, the brain is a muscle. You want to keep it moving and keep those cognitive functions going in terms of doing your daily activities, trying to keep up with your finances, going to the grocery store, taking care of any kind of math problems and little games you want to do, but really keep that brain going is what you want to do at that age. That age, you still want to visit your health provider regularly, but there aren't as many screening things that we tend to do after the age of 75. At that point, it's just about maintenance.
I asked a couple people in the community some questions. Men's health, libido, guys.
Oh,
Libido
yeah, it's
takes
big.
a big old nose dive. How does one get their libido back?
Well, you can have your testosterone checked and see if the testosterone level has something to do with it. We do have testosterone replacements that we can use. Other than that, it really can be psychological, and so you've got to look at the psychological aspects. If you're really holding in something that's been going on for a long period of time, your libido is going to be affected. So
holding in something like a resentment towards someone or a situation,
a relationship that isn't working, it's something that's going wrong with your job, a depression that we haven't recognized, anything like that is going to affect your libido.
Anything with diet too? Can diet help at all? Any herbal remedies?
Well, certainly people who are overweight are going to have more of a problem with sexual activity. It's going to be a little less so with libido. It's going to be a little bit more with the actual physical sexual activity, but that can affect the situation.
So guys, if you want to get happiness back into your life, clean up that situation that you're hanging on to, because I actually, after the show, have a few phone calls to make just to stay in the game. Why is it that when young men eat pizza and spicy food, everything is great, but now all of a sudden, as his name's Frank, he's 48, it's really hard?
Yeah.
Spicy food, 48. He said Maalox and Tums are my best friend, and I also can't eat late at night anymore.
Right. Well, when you have a young body, your body can deal with a lot more than it can once it gets older. And if you've been rough on your body for a long period of time by having a pretty unhealthy diet, which is basically pizza and ice cream and things like that, not only are you probably gaining weight, especially around the abdominal section that puts more pressure on your belly to cause more reflux, but if you've had just that high acid state and you haven't been treating it, you can have more problems with your esophagus that can lead to chronic heartburn, dyspepsia, gas, problems with constipation, things like that. So the best way to avoid that, again, healthy diet, high in vegetables, high in fiber, so that you can keep everything moving through in a healthy manner.
What's the cutoff rate of eating at night? Cutoff time?
Well, I think that's different for everybody, but what we suggest to people is basically 3 hours before bedtime or 6 or 7 at night, something like that.
Okay, Leon, 35, his oldest child is 2 years old. Does he remember everything already?
Oh, the child?
Uh-huh.
Interesting thought. Well, again, it's different for those kids, and you'll find out later in life because they'll tell you what they remember.
Mommy, Daddy, do you remember this?
But generally speaking, I would say that no matter what your child's age is, don't do anything where you're going to be concerned about whether or not they're going to remember it.
Okay.
Because even if they can't fully remember the situation or the event, it might have affected them in some way that you didn't mean.
Emotionally or psychologically.
For them to be affected.
Okay, on 35, his oldest child is 2 years old. Does he remember everything already?
Oh, the child?
Uh-huh.
Interesting thought. Well, again, it's different for those kids, and you'll find out later in life because they'll tell you what they remember.
Mommy, Daddy, do you remember this?
But generally speaking, I would say that no matter what your child's age is, don't do anything where you're going to be concerned about whether or not they're going to remember it.
Okay.
Because even if they can't fully remember the situation or the event, it might have affected them in some way that you didn't mean.
Emotionally or psychologically.
For them to be affected, yes.
Zach, 26. How do you keep your metabolism high even after 30?
What do you think the answer to that is?
Workout, exercise.
Exercise.
Have a colorful plate.
You got it. Activity. Just keep yourself moving.
2 more questions. We're going to carry one into the break. Day 50, he pushes his heart rate to 180 BPM during biking. Is it okay with someone that is 6'4" and at age 50, he rides his bike 1,000 miles a year?
Wow. Well, beyond the fact that I'd be a little concerned with so much activity doing one thing, that I'd be concerned about joints having some kind of a repetitive motion damage. Beyond that, I think that sounds great because he's getting a ton of exercise. His maximal heart rate is, generally speaking, going to be 220 minus his age. So he was 50, and so we're talking about 170. So he's a little bit above what his basically target heart rate would be for the maximal benefit for exercise. So that sounds great.
Dave, you keep on writing. When we come back, we're going to do our wrap up. We have one last question, and we're going to knock out a few questions and answers on vitamins and supplements. Don't go away.